Hi everyone, this is Lahiri from ABCs of Anesthesia. Now I'm really excited to present to you our very first fully online course that I'm launching today on YouTube. So let's get started. Now, this course is called The Medical Student's Guide to Anesthesia, and I've hosted it on this platform called Thinkific, which is a fantastic way of just presenting this information in an easily digestible way for all my students. So the first important thing when you sign up, make sure you use this coupon code MEDSTUDENT70, so that makes sure that you get 70% off this medical student course. I'll make sure I put all the links and the coupon code in the story notes below as well. So Medical Student Guide to Anesthesia. Now the reason I started this course is that I think anesthesia, learning anesthesia as a medical student can be really challenging. You may only get even one session, maybe if you're lucky a week, 2 weeks, and if you're really passionate about anesthetics, you might get even 4 weeks on your elective placement. But generally speaking, anesthesia isn't that well taught in medical school. So I had a couple of fantastic helpers, Ikram and Victor, and they went through the curriculums, the anesthesia curriculums in many of the universities around Australia and compiled them together. So pretty much the curriculum here is pretty much based on what you might find in any medical student curriculum in Australia. So let's get to it. So this is a Medical Student's Guide to Anesthesia, and essentially this whole course goes through that curriculum. But what I found out was a problem with a lot of these curriculums is that the amount of knowledge to churn through in just maybe a session or a week of anesthesia is just simply too much. So I thought, what are my aims? I want you to get a really good foundation of the basics, practical knowledge when you get into your rotation. So that's what this course is about. Lots of practical information, but only the essentials. So we're not going to get bogged down by lots of basic pharmacology and physiology. We're going to get to the stuff that's very useful for decision making and what most anesthetists do. And that way I think you'll have a much more interesting experience because you'll be talking with anesthetists and trainees who are senior at their level and talking about really advanced concepts, even with just a little bit of knowledge. So the first step is anesthesia resources. So I've got this whole section just on the best resources. Now, it's one of those things where it's not necessarily important that you remember everything, but if you know where to search for something, that's far more usable, especially if you're only going to be doing anesthesia for a short amount of time. So I've got a whole section just on where to find the best resources, including websites, YouTube, podcasts, and textbooks as well, journals and apps. I've got a whole section on essential frameworks in anesthesia. And so whether you're doing surgery, anesthesia, physician training, general practice, peds, or whatever it is you're doing, if you have really solid frameworks at the start, it'll mean that the more advanced you get, the more knowledge you acquire, the more skills you acquire. If you have a really solid framework to attach those concepts to, you will do better. And so I take a lot of time in making sure that you're very solid with your frameworks. You'll be able to answer these questions with far more knowledge and just this kind of broad approach to things, which will be very impressive to your supervisors if you can get this stuff down pat. So we covered that in a bit of detail. And we go through a number of other things. So we go through preoperative assessment. And again, this is one of those things, this will be your bread and butter. So when you're on your anesthetic rotation, or any rotation, you'll be seeing patients time and time again. And so what I want to give you here is some of the most practical stuff with preoperative assessments, because you'll be in pre-admission clinic, you'll be seeing patients before they go into theatre, and this is the whole framework. I've also provided some templates that will assist you in checklisting off to make sure that you've got all your questions covered straight away and you don't miss anything. That way you can present something back to your consultant with a lot of knowledge and a lot of authority, even at a junior level. So we go through all of that, past illness history, past medical history, medications, allergies, fasting, examination findings, airway exam, all those basics that you'd be expected to know on day one, we cover that. Now next topic is quite broad. I've been limited here because we'll cover this in far more detail in future courses, and you can also look at this in the ABCs of Anesthesia Bootcamp playlist. But we go through what is general anesthesia and what's the vibe of anesthesia. So I want you to be able to get anesthesia as early as possible. So we go through essentially the purpose of anesthesia and how to approach it from a practical point of view. We also go through monitoring and how you can be helpful there, and clinical handover. Again, these are some of those really high yield topics that will make you useful even as a medical student. Now, one of the things that will be really vital to you in your rotation is anesthesia pharmacology. Now, a lot of what we do is based on the drugs that we are able to give to achieve certain endpoints. And so again, a lot of these drugs you will have never heard of except in your anesthesia rotation, and that's why we need to go through it in a bit of detail. So again, I'm not going to teach you all the really esoteric numbers, the PK, protein binding, the numbers that you're not going to remember. I'm going to teach you the principles and the points of difference of each agent and why they're special and what are the harmful side effects. So if you can get those things, the main action, harmful side effects, and special features, you'll be able to make decisions even at an early stage on choosing one anesthetic agent over another. So I want to give you that, coverage broadly, but also with some advanced, facts and frameworks just from the start. A big part of your anesthesia rotation is likely to be your pain rounds and pain management. Whether it's ordering multimodal analgesia intraoperatively and postoperatively, or doing pain rounds and making sure that your patients are well after the operation, you'll be really able to impress your supervisors by being able to take a good history and clerk patients, knowing about pain, knowing the definitions, and doing basic things like an assessment of pain in a very structured way, as well as managing pain with multimodal analgesia. So again, at the end of this session, these lectures, you should be able to assess pain and be very useful on your pain rounds by documenting the historical findings, as well as being able to make sure your patient's on multimodal analgesia and make a referral if necessary. All of that stuff we're going to cover. Next session is fluid therapy, and again, this is so high yield, whether you're anesthetics or ED or just a junior doctor on the wards covering, making sure patients are adequately resuscitated, having their daily fluid intake. This lecture is really important. We go through how fluid distributes in the body. Again, how an anesthetist thinks about fluids and how fluid distributes is really important. So you get kind of the lingo that we talk, the way we talk about fluids. And it's also how do you assess and how do you treat this? I want to go through all the basics, but there's actually not too much there that you need to know. If you have this framework, you know how it distributes, you know how to assess it, and you know how to treat it in a very structured way, you'll be able to, again, just hang on extra knowledge as you learn it. So as you can tell, most of anesthesia is really clinical anesthesia, pharmacology, basic physiology, and then procedural skills. Now, a lot of the procedural skills you will learn on the job. It's very difficult to teach through a video how to bag mask someone. Once you get your hands on a patient, supervising, ventilating them, using an LMA, using bag mask ventilation, intubating, you will learn a lot of these things really quickly. So what I want to do here is go through IV cannulation. Now, IV cannulation is considered a really basic task, but I think it's one of the most important tasks you ever will have to do and can be one of the most challenging. Now, there are a number of times when you will see even an experienced anesthetist taking an hour or so to put a drip in because IV cannulation can be really, really difficult. In this lecture, I go through so many different skills and techniques, but I think it's really that important. I go through almost everything that I know about IV cannulation in this section with a combination of videos and resources. So I'm hoping that that'll be really useful to you, whether you're going to be in your anesthetic rotation or as an intern and junior doctor. I mean, I think one of the most important things as an intern or junior doctor is that you're going to be time poor. There's going to be so many things asked of you. And one of those things is going to be cannulation after cannulation. If you can cut your cannulation time down really short, make sure you don't fail too many times, and you're really efficient and spot on with your technique, you will save time that will be better spent learning and managing your other sick patients. So that's the Medical Student's Guide to Anesthesia. I'm really excited about this course. It's the first fully online course I've ever created. I'll put the link down below. So please sign up if you have any feedback, if you have any questions, or anything at all, please put it in the comments. I really want to make sure that this is a really valuable resource. And if you have any feedback for me about the course, feel free to contact me at abcsofanesthesia@gmail.com. So thanks very much for watching. Please share with anyone who might be interested, and I'll see you next time.